also director of Global Vision Foundation and Global Vision Community Health Center. Dr. O, you're welcome to your program.
Thank you very much. We have another exciting evening. Dr. Ajagbe is our very own, and I'm excited that he's going to be talking to us tonight about a very important topic. Sleep is very important to our general health. We have also found out that the brain cleans itself out in sleep. We didn't know how the brain cleaned itself out for years until not too long ago. So having a good night's sleep or restful sleep whenever you can do it is very important. And having obstructive sleep apnea, which is now very common, more common amongst us than we realize, is not something helpful or healthy. So I'm going to yield to Dr. Ajagbe to give us this very important, information and guide us to have good and restful sleep. Dr. Ajagbe, over to you, sir. And thank you so much, Honorable Gustav.
Good evening, ladies and gentlemen. I'm glad to be here with you again to present this topic on sleep apnea. I don't want to use big English or big medical terms for the sake of guests who may be challenged by all of the terminology. So I'm just going to try as much as possible to say it in plain English. Sleep apnea is a title that refers to the situation in which case someone while sleeping stops breathing for more than 10 seconds at a time. And most of the time they can stop breathing like that several times per hour during the night. And if you pay attention to that, when somebody sleeps and wakes up within few minutes of sleeping, you know that it's almost like somebody coming to wake you up every time you are falling asleep. You can see how irritable you will become if that happens to you. Let's take it just simply, if you are dozing off and I come and wake you up and I say, oh, don't worry about it. And then you fall back asleep. And as soon as you're falling back asleep, I tap you to wake you up and I say, oh, don't worry about it. If that happens to you about 5 times to 10 times within 1 hour, you'll be very upset with me doing that to you. But in the case of sleep apnea, it's not somebody waking you up. It's just the way your body rouses you up if you do stop breathing. Somebody has said it that it seems as though the person who is suffering from sleep apnea actually dies temporarily, and the brain wakes the person up. Now, if that happens several times in the night, you can imagine how non-restful the person will be in the morning. So that is basically what sleep apnea is all about. We don't want to go into all the different details of the different kinds of sleep apnea, but the one we are going to focus on tonight is the obstructive type of sleep apnea. This occurs usually when somebody falls asleep, particularly when they lay on their backs and they fall asleep. The muscles of the soft palate usually will become relaxed, and the tongue also becomes involuntary at that time because the individual is at rest. And when that position is assumed, the tongue and the soft palate often will close the airway in the back of the throat. And when that happens, it means when the individual is breathing while laying down to sleep, is going to be breathing through an occluded space, which then makes it an effort to breathe in and a loud vibration when the individual is breathing out. So most of the time, what we find out if the individual has a bedmate is that the bedmate will become disturbed because there's so much loud snoring through the night, and many times the person suffering from sleep apnea will wake up gasping for air, or sometimes will even act out their dreams, whatever it is they were dreaming about. Sometimes these individuals may have, frequent urination during the night, and it's part of the body's coping mechanism to make the individual continue to breathe and have enough oxygen for the brain. Now, one of the main reasons why sleep apnea is a major problem for the population is that when the brain does not get enough oxygen because of the frequent stoppage or cessation of breathing during the sleep, the brain is not, as Dr. O was pointing out, is not fully refreshed, which is supposed to be the case when we fall asleep at night. So in this case, anyone who has some of these, possible signs, or symptoms, need to be evaluated for sleep apnea. If you find yourself to be waking up frequently at night to use the bathroom, and then you fall back asleep, and then you wake up again to use the bathroom, it may be an indication that you do have sleep apnea. You may not be snoring as loud as some other people might be, but the frequency of urination is a sign that your body is trying to wake you up in a state of fright, flight, or fight state. That is the sympathetic innervation. And usually that causes anxiety. And most of the time when people do, aroused in that fashion, they have, they appear confused. Some of them appear, very angry because they don't even know what is causing them to be angry. So if somebody goes to use the restroom frequently at night, that is what is called nocturia. It is very important that that individual will discuss that with their doctor so that they can rule out sleep apnea. For some of the people who are having increased forgetfulness, that they become more confused, they become irritable, they become, they have excessive daytime sleepiness. These are things that should alert the individual to be screened for, sleep apnea. Now, many children have been diagnosed with ADHD, which is the same thing as attention deficit disorder or hyperactive disorder. Many of these children have not been screened or even been diagnosed, with sleep apnea. And there are many studies now that are documenting the correlation between attention deficit hyperactive disorder with sleep disordered breathing, primarily the obstructive sleep apnea. Now, we also know that many of the children that do have the attention deficit disorder also have malocclusion. That is, they have crowding of their teeth. Many of them are in braces. Most of those children are mouth breathers. This is also as a result of the fact that their jaws are underdeveloped. So we do have quite a number of, pointing factors to what could be the underlying problem, which is the obstructive sleep apnea. Now, how do we diagnose? How do you know that you have sleep apnea? the first thing to do is to actually be screened for that. And there's a simple tool that's available. You can actually find it online. You can do a self screening by looking for the excessive daytime sleepiness questionnaire online. There are different tools, but they are similar in proving to the individual that they do have a problem with staying alert during the day. And if they cannot sit still without falling asleep during the day, it means they do have what is called the excessive daytime sleepiness. Now, that is a major indication that they should be evaluated for obstructive sleep apnea. We're not saying that everyone that has excessive daytime sleepiness has obstructive sleep apnea, but it's more likely that anyone that has excessive daytime sleepiness will have sleep apnea. So to diagnose the sleep apnea, once the screening kind of indicates that the individual has the potential to be apneic, the thing to do then will be to talk to their doctor. If the individual talks to the doctor would generally request a sleep study. There are two main kinds of sleep studies. The biggest one, is the one that the individual will go to the lab and they will hook the individual up, and the individual will be observed through the night by a technician who will be taking notes of all of the activities of the individual with the different sensors to determine the quality and the pathology of the sleep, ranging from the airflow to the blood oxygen concentration to the movement of the legs and the hands during the sleep, and even some people bedwetting and all of that stuff. All of those can be observed in the lab. That is called polysomnography, and that is the big one that you have to do it away from your home. Now, the second kind of sleep study that is available now is the self-administered home study, home test that the device will be sent to you, and then you will follow the manufacturer's instruction, and the recorder that is sent to you will record the quality and the pattern of your sleep, how many times the individual stops breathing during the night, and all of those will be documented and will be uploaded usually through to the server, where the specialist who is qualified to interpret the sleep study will give a report. Now, that report is often very important, particularly for those who will have to get insurance approval or pre-authorization for the treatment. Now, there are many ways to do the home sleep study, but with varying degrees of difficulty. Sometimes the individuals are very, are very confused about how to use the devices. And so many people don't follow through with the home sleep test as well, because if it is very cumbersome and it's very difficult to follow the instruction, the individuals who are not technically savvy may just decide to let it go and not comply with that. In that line of thinking, there are newer devices nowadays that actually are FDA approved, and they are used very simply, and you can use them at home. Now, during the course of my presentation, I'll share a few pictures with us so that you can have an idea of what I'm talking about. Just give me 1 second, and I'm going to share my screen.
It's very informative. It's Medical Mondays with Dr. O. So Dr. O, she has different doctors coming on to talk about different things. Remember last time they wanted to cook. This one is on sleep apnea. So Dr. Family, today is sleep apnea. So
AJ, meet yourself.
AJ or Gustav, somebody is running commentary in the background.
Yeah, I've muted the person. Go ahead, please. It's muted. The person
Okay. Anyway, I wanted to just share a few pictures with us. The first one is on the left. You can see this is a CT scan of the head, and the color is showing. The color banded area is showing the airway and how narrow the airway is. You can see it's like a funnel that flares up at the bottom part. The yellowish, orange, and red part is actually indicating how restricted the airway really is. And you can see in relation to the tongue, the gray area to the right of the funnel, that whole area is the tongue. Now you can see if the tongue relaxes, it can actually close the airway from the green part to the red part very easily with the tongue falling back. And that is one of the reasons why when the body is aroused, when the individual is aroused to wake up, when they stop breathing for more than 10 seconds, then they move their jaw forward in order to pull the tongue away from the obstructed airway. So these are several. On the right side of the same picture, you can see the different sectioning that to show the airway in cross section as well as in longitudinal section. Now, this is what usually entails. If you look in the color coded picture, you can see that here you see the before and after picture on your left, and then on the right side you can see an image showing the teeth and everything like that. Here is the most recently approved device for sleep study, for home sleep study. This is a ring that actually is very easy to be used by anybody. You have the adult size and the pediatric size for the children. And you can see in the picture to the right, when the ring is worn, the sensor is activated and there's a red light that shows. And you can see the bottom picture. This is when the ring is removed. There's no red light showing through that ring as of this moment when it is not being worn. So for those who might be interested and want to know more, there is a sleep ring home test, a business that is available where you can actually rent or buy the ring in order for you to do your own sleep study. The thing about buying it is if you only need the sleep test once, the sleep ring is no longer useful to you after one use. But if you rented it, then you don't have to, waste your money to, if I apologize for using the term waste your money, but you don't have to keep something that you don't need long term. But at least you get the result that you need from the sleep test if you rented the ring and have it returned to the vendor. To use the sleep ring is very simple, and I have the steps here just to help you follow the steps. When you get the ring, let's say you are interested, or your doctor, refers you to have the sleep test done, and you want to use the sleep ring home test. The ring comes to you in a box, pre-packaged box, and then you take it out and you will charge it, and then before making sure that both the ring and your smartphone are both fully charged before you go to sleep. The ring will be, paired with the app that will actually drive or record the sleep activity during the night. And so what happens when the individual is positive? That is, the sleep ring actually confirms that the individual has, obstructive sleep apnea. We now know that there are many ways by which sleep apnea is being managed or being, treated in the medical settings. The most common one is the Cpap. Cpap is continuous, positive airway pressure. That is what Cpap really means. It means there's a machine that continually uses a constant pressure to open the airway so that the individual can breathe normally. Many people who have very severe sleep apnea can be helped, by this device. And this device, is portable in some cases, and sometimes it's not very portable. But the problem with this is that the compliance rate is very low because many patients can't endure having the mask and all the hoses and all the sounds throughout the night when they are trying to sleep. So compliance with the Cpap is very low, and therefore there are other alternatives that need to be considered. Other alternatives include surgery, and these are invasive procedures that can actually attempt to treat the sleep apnea, but is not only is it very expensive, but most of the time they are very invasive with potential complications. While we're talking about treatment, there is now a new approach, which is a painless alternative to Cpap, as well as alternative to surgery and all the other, invasive procedure that do address the underlying cause. The new FDA-approved approach is using what we call the biomimetics. And I don't know if you can see on this chart. I'm trying to enlarge it. Can you see it better? I apologize if it's still very tiny. But if you can see, there are at least 6 columns on the chart that compare the different devices. 3 of them address the underlying causes. That is the biomimetic, oral appliance therapy, as well as the 2 surgical approaches. The others do not. The others, once you start using them, you are going to use them for the rest of your life, because they do not address the underlying cause. The surgical approaches will try to move the jaw forward or reduce the tongue size if that is the problem, or any other surgical thing that it can do to move tissues away from the airway from being obstructed. However, the biomimetic, oral appliance therapy uses, an FDA-approved as well as patented device that actually causes the growth of the jaw bones to increase the space occupied by the tongue, as well as bringing the soft palate forward rather than going backwards once the jaw bones grow. This is the most predictable and non-invasive and painless alternative to the other treatment modalities. Now, this approach requires a multidisciplinary, approach. Multidisciplinary way of, managing the individual. Not only would the individual receive the appliance that they can put on and take out on their own, they will also have the functional therapist, monitor their progress as they are going through the treatment modality. Now, this biomimetic device will be used usually during the night, in the evening as well as the night. You do not wear the device during the day. When you wear the device, you wear it while you are relaxing. As you can see right here, the device on the screen right now, what we call the mRNA, the top one on the right is the mRNA. It's a combination of upper and lower. And then the bottom one is the DNA, which is the day and night appliance. And so these two appliances are used, by the individual that do have sleep apnea, and with the technology to stimulate bone growth at any age. So there is no age limit to who can benefit from this device. We used to think that from the age of 21 to 25, the jaw bones stopped, no longer have the potential to grow. But this device has proved that to be not the case. So anybody can have their jaw grown out, particularly if they have not reached their full potential of jaw growth. And the side effect to this is that if your teeth were crowded before, you may end up having very straight teeth at the end of the treatment with this device. So the summary of my presentation is that there is hope for anyone who might have been diagnosed or is yet to be diagnosed with sleep apnea, particularly the obstructive sleep apnea. And they can survive and live well and have an improved quality of life just by wearing the appliance for 12 to 16 hours a day, which is only limited to the evening and night time. During the day when they are active, whether they are at work or at school or at play, they do not need to wear the appliance. So it won't affect their daytime activities, whether in terms of speech or in terms of interaction, with the public. Well, at this point, I will stop and I will wait for the time of question and answer.
Thank you so much, Dr. Ajagbe. That is a detailed presentation on sleep apnea, and we are grateful for all that you have shared with us. I have a question. How helpful is a change of sleep position? How does it help someone with a sleep apnea? Right?
Well, the change of sleep position should help somebody with sleep apnea, particularly if they don't have any problem sleeping on their on their tummy or sleeping on their side. Now, most people cannot stay in that position for a long time. And the default is usually they will roll back on their back, and they will stretch their legs and stretch their arms, because most of the time when you lay on your side, the tendency is that you will fold your legs. And that, over time will not be as comfortable as rolling back on the back. Now, a lot of people might enjoy laying on their tummy. In that case, the jaw is forward in that position. And if you are disciplined enough to do that, maybe you can, just avoid having the sleep apnea just by lying on your tummy. But if the problem is not just the posture, but because of anatomic, deficiencies or abnormality, then changing your position is not going to change anything. You can lie on your face, you can lie on your side, it will not change anything because the tongue has nowhere to go. It's just like trying to put a limo in a regular size, a garage. How is that going to happen? I mean, the limo can be inside, but the behind of the limo will be sticking a few feet outside the garage door. And that's kind of the situation when you have a mouth that is so small for the size of the tongue. There is no room if the person is not a mouth breather, then the next thing is the tongue will be pushed to the back of the throat. And there is nowhere else for the tongue to go other than to block the airway.
Thank you so much. Let me go to the chat. Tawa asks, is there a connection between sleep apnea and a stroke? Also, does sleeping pill affect sleep apnea?
Well, let's take the first one. Most of the chronic debilitating diseases, including high blood pressure, diabetes, dementia, even obesity, many of these have been attributed to the underlying cause of obstructive sleep apnea. And it's like, which one comes first? That there is a very close relationship between sleep apnea and all those chronic debilitating conditions. So there's a body of literature that supports the fact that once you treat sleep apnea successfully, all of those other chronic problems also will, seemingly automatically be amended or be treated. So we see that with those people who have chronic headaches, and once the sleep apnea is taken care of, the headache is gone. Early morning headaches that most of those people have is gone. We found that also to be the case with those people who grind their teeth all the time during the night. And once the sleep apnea is managed, the grinding of their teeth and clenching is also, taken care of. There are, also with the blood pressure, also with dementia. If people get enough oxygen into the brain doesn't have as much plaque as will continue to accumulate due to the chronic shortness of oxygen or low oxygen concentration in the brain.
Thank you so much. There's another question in the chat from the same person. Does uvula aid the tongue in creating occlusions to the airway?
Yes. The uvula as well as the soft palate are made of soft tissue. There is no bone in that area. And usually they are voluntary when we, to some extent, particularly when we are swallowing, there's a way that the muscle will contract, but in most cases, they are involuntary in their actions. So when it's time to sleep, all of the skeletal muscles in the body will relax. That's why when somebody is sleeping, you lift their arm, it drops. When they're sleeping, you lift their arm, it drops. The same mechanism or similar mechanism that happens to the muscles of the arm will happen to the muscles in the throat. So if you are laying down, unless you are actively eating something in your sleep and you are swallowing while you are sleeping, your throat is paralyzed. You know what I mean? Semi-paralyzed. That is the reason why the muscle will fall to the back, you know, because it's relaxing. I mean, there is nowhere else to go. The only reason my tongue is not falling to the back as I'm sitting upright is because my jaw is forward and I am actively using my tongue during the speech. Now, if I fell asleep and my head is backwards, if I lean my head backwards and I doze off, guess what's going to happen? I might wake up gurgling and coughing because my tongue has obstructed my airway. So the uvula, yes, is part of the soft palate, and it will descend and relax during sleep.
Thank you so much. Before Dr. O comes in, another question. Does weight loss help? And what effect does sleep have on weight loss?
Well, okay, definitely anyone that has a neck size of more than 16 inches for women and 17 inches for men has the potential for, sleep apnea. And for your neck to be as thick as that is an indication of your weight. And most of it, in most cases, somebody with that kind of neck size will be obese or borderline obese. Definitely when you have double chin, that is, you look in the mirror and you have your real chin and then you have a swelling behind your chin close to your neck. And many times you actually see a swelling in front of the neck as well. It may not be goiter, it may not be swollen thyroid gland, but it may just be extra fat that is around the neck. So when you have double chin, which we call jowl, and then you have, a lot of fat tissue in the muscle of the tongue, causing the size of the tongue to be larger than normal, all of those will affect the airway. It will cause obstruction to the airway. Even when you are not sleeping, you can see that some obese people, when they are breathing, you can hear they are breathing across the room. It's not because they want to be loud, but it's because the airway is partially occluded. And if it's partially occluded, when air is going through, it causes vibration of the tissue around it. The soft tissue around will vibrate, and that's where the sound comes from. And so, yes, losing weight is imperative for anyone who is obese, who has been diagnosed with sleep apnea. Without the loss of weight, most of the other, treatments may not be effective. Because if the person is getting bigger, and you are doing every other thing, you are increasing the pressure from the Cpap for airway to be open for them to breathe, it will get worse. And at some point, there is no pressure that can open the airway using the Cpap. So they will not be able to survive. So weight loss is very important in controlling the sleep apnea for somebody who is obese. Now, if you control the sleep apnea, the chances are that the reason why they feel they must eat Sometimes it's because they want to stay awake. It's because during the day they have excessive daytime sleepiness. They have to keep chewing, eating something in order for them to be awake. And if that is the case, it's like a Russian roulette. I mean, they cannot escape gaining weight. And if they don't lose weight, the sleep apnea gets worse and it keeps on going.
Thank you so much.
Thank
Dr.
you so much. Excellent conversation. You said something about increased urination and sleep apnea.
Yes.
So I'm just talking about my patients who have shown up in clinic, getting up several times at night, that have this frequent urination at night. So should we screen them for sleep apnea?
Yes, absolutely. In actual fact, there are a few articles that are out there now that is pointing in the direction that any patient that complains of nocturia, that is, they have this frequency more during the night, not during the daytime, but during the nighttime is a sign until proven otherwise that it's sleep apnea, obstructive sleep apnea. Because this sympathetic innervation is stimulated when they stop breathing. And the way they cope with that kind of sympathetic stimuli is the fight, flight, or fright mechanism. The way their own body copes with that is to go and pee. It just it kind of tells them that their bladder is full, even if it's only a few drops that comes out when they get to the bathroom. And it's not because they have prostate, because women don't have prostate. Some women too have the same thing. So if that is the situation, if a patient complains of frequently going to use a bathroom or peeing at night, they must be screened for sleep apnea until proven otherwise. And if they begin to tell you that they do have excessive daytime sleepiness and every other signs and symptoms of that indicates that they may be having sleep apnea is there, they need to do a sleep test. And the sleep test will always confirm that they do have that. Now, if they are skinny, they do not have any excess tissue, their jaws have grown properly, and all of these things are going on, and they still have that, it means they have central sleep apnea, which has nothing to do with obstruction. It's just that they die momentarily, and the brain has to wake them up to say, okay, it's not time for you to die permanently, wake up. And they can have that several times during the night.
Thank you so much. I asked that because insurance companies are not in line with that. When we send patients for sleep study, as you know, we have to have reason. For any referral, you have to have reason. Snoring used to be acceptable to test somebody for sleep apnea. Now, snoring is not. If somebody is snoring, they have to have other symptoms like, somebody having observed them, that they stop breathing during the night, or they have daytime sleepiness, or they're watching TV, they cannot watch a whole movie without falling asleep. Symptoms like that are acceptable by insurances for patients to do sleep study. So, nocturia, that is, excessive urination at night, is not one of those indications for sleep study. So insurance companies need to catch up with this new.
Yes, actually, you are absolutely correct. But the problem with the problem that we are facing is that it is not the insurance should not be the I know because they are the payers, but they are not diagnosing the patient. Because if the patient is not treated because the insurance says, okay, well, we don't accept nocturia as a sign or an indication for the treatment of sleep apnea. Well, at least, the patient needs to know that this is a potential source of a problem, because I think what we, providers must be aware of is once the patient begin to become, more enlightened about some of these things, well, they might become very, very unhappy, because if they've reported to us those symptoms and we ignore them, not that we want to ignore them, but we say, oh, the insurance is not going to do anything, because if I say you should go for a sleep study, who's going to pay for it? Because, well, the patient will always turn around and say, but you are the doctor. You knew about this, but you didn't do anything about it. So anyway, we have to maintain that balance. And it is for us to educate the insurance company, actually, because if you have submitted claims in the past that they initially denied it, then I have a published article as an addendum, and accompany my resubmission of claims. And once they saw that it was in a referee journal and it was not a cock and bull story, they accepted it. And that was the basis of my getting prior authorization for a lot of my patients that needed implants in the past. Most insurance don't want to pay for it. They say, no, we're not going to pay for dental implants. But when you now show to them that there are connections between edentalism and high blood pressure, between edentalism and diabetes, and you can have that correlation and connection between somebody having no teeth and not being able to process their food, and hence becoming diabetic, or hence becoming obese, then it's immoral for the insurance company to say they're not going to pay for such treatment if they need such treatment. So I think it's a balance between, what you think will be moral as a practitioner, and what you think the insurance are, going to pay for.
I agree with you a lot, Dr. Ajagbe, but on that one, I beg to disagree, because as far as we are concerned, I'm just a physician. I can order anything I want. The patient is at the mercy of the insurance company. We do prior authorizations, and if the insurances don't approve them, there's nothing we can do. The information is great, it's timely. I'm just asking, to see how we can get insurance companies to come to the same page. I just had a patient who was sent to me when he went for DOT testing. That's special
transportation
license who drive, trucks, buses, and stuff like that.
Yes.
He was sent because he has weight on him. So we want him to have sleep study done to make sure he doesn't have sleep apnea, because if he does, it would endanger the people he transports.
Absolutely.
So, intervention. Well, I asked the patient pertinent questions that I know that the insurance company will look for in order to approve the referral for sleep study. He said he didn't have any of them. The same questions I just raised, or the same things I just said here. No daytime sleepiness, not falling asleep when watching TV. He said he snores, but his wife never told him he stops breathing, and he doesn't have any problem like that. He sleeps through the night. He was very agitated, actually upset with me because I was trying to figure out how to help him so he can get his sleep study and get his CDL license. And I explained over and over that I'm just trying to help. He said he didn't have any of these things. So I wrote that he snores, and because that's all he has, and that he needed this study because of weight. Weight is not a reason to get sleep study also. They don't, it's not.
Well, obesity is acceptable as an indication for sleep study, particularly when you examine the patient and you can see when the patient opens their mouth that their airway is crowded by not just very lax uvula, as well as the soft palate that is descending, as well as macroglossia. If you have somebody with big tongue, that it's in itself is a developmental abnormality, which causes obstruction of the airway. And that definitely needs to be evaluated further. So those are, if the individual has weight and they have a big jowl, or what we call double chin, and definitely, and they have a neck size bigger than 17 inches, there is no reason why any insurance would deny that.
Thank you very much.
Let's get to the chat and a question. I have been diagnosed with mild sleep apnea and severe snoring years ago. I have the Cpap machine and I started using it at night, but I take it off during the night. Do you have any remedy for severe snoring?
Severe snoring, yes. Cpap is still the most acceptable pathway for severe sleep study and for severe sleep apnea. And that is because it's still non-invasive. It is something that may be cumbersome, may be difficult to wear through the night, but it's still the, if you want to call it that, the gold standard for treating sleep apnea until other modalities catch up with it. It does not address the underlying cause, which is most of the time the developmental abnormalities that occur in the oral and nasal area of the head. However, the Cpap needs to be titrated regularly to be sure that the pressure is not the reason why the individual is taking it off during the night. Because if it's not well titrated and the pressure is uncomfortable, the patient will not be able to tolerate it through the night. So for severe sleep apnea that does not have a lot of structural issue, surgery may not help. And so, going for surgery, unless there is a major indication to advance the jaw forward, the individual may not benefit from it. So for severe sleep apnea, Cpap is still the first line of treatment. For those who have jaw deformities and underdeveloped jaw, the biomimetic device will be the best approach, because that's going to give a permanent treatment for the, to permanently treat sleep apnea. So whether the person has severe sleep apnea or moderate or mild, the biomimetic device is very helpful, is very efficacious.
Thank you so much. Go on, Dr.
Ms. Alicia, that you talk to your physician and see if they can try the nasal tongues. For the Cpap, they'll give you a mask. It's like a mask type thing, device that you put over your mouth and your nose. Some people are uncomfortable with that. They don't tolerate it well, and that's why they take it off. But sometimes the nasal prongs can be better. Some people do better with that. So let your sleep study doctor know that you are not able to tolerate the device you have right now. Or maybe it's not well fitted, is what the problem is. And they would maybe bring you back to the sleep lab and try different devices to see which one will work best for you.
Well, in addition to what Dr. Oluwole has said, sometimes it's not so much about the cumbersome nature of the face mask. It's just the pressure. When you mention the nasal prongs, one of the things people will tell you is uncomfortable to them about is to feel something that is abnormal, going through your nostrils. Even if anything, any air, any stream of air that is faster than what you breathe normally goes through your nose, is very uncomfortable. And so the nasal prong, some people might say, well, they prefer it because it's not covering, 1/4 or half of their face, but it still there's still a very low compliance rate with that as well. If you have mild sleep apnea, my advice to you would be, to actually be fitted with the biomimetics. After a thorough examination to see why you're having sleep apnea, if your jaw is fully formed and your tongue is normal size, then you may not need a biomimetic device. It may just be that you have a central sleep apnea, which is totally different ballgame.
Yes, there could be. I have tried both the nasal. I mean, this has been some years, probably over 10 years that I've been diagnosed, and I have the machine, and I've gotten different types of masks. I've found the full face mask to be the most comfortable, but it is exactly what you said, sir. That pressure, it is too much. And so what happens is if I get up to go to the bathroom, or if my sleep is disturbed during the evening, during my, the middle of the night, I can't put it on. I can start my night off like that, fine. But anything that interrupts my sleep in the middle of the night, I end up not putting it back on.
Yeah, I mean, and you're absolutely right. That's one of the reasons why compliance rate is very low. Remember, the fact that you're using a Cpap does not mean that you have a zero apneic event. You see, having apneic event is just not as frequent as before you use the Cpap. So that is one of the things that people need to understand. For somebody who has a sleep apnea score of 97 per hour, when you use a Cpap, you might bring it down to 30. 30 events per hour is still severe. So even in that kind of situation where you see a reduction in number, it does not mean that you do have a cure or a reversal of the sleep apnea. Now, most of the time, it's just because, you increase the pressure, from the Cpap, and the patient may tolerate it for the first hour, but they can't tolerate it for the rest of the night. But the airway may be open for that 1 hour, and they can say, wow, they feel, a lot more oxygen going through their body, but the pressure from the machine is intolerable. So I will, if I don't know what your situation is in terms of doctor relationship, but it would be nice to know what you look like in terms of your oral environment. And do you have nasal blockage? We're not establishing any patient-doctor relationship. These are just rhetorical questions I'm asking. Like you ask yourself, do I breathe well through the nose? Does my nose always feel blocked? Am I a mouth breather? All of these things are, factors that will determine how well your sleep apnea will be managed.
One more question, and then I'll let others have a chance. Do you suggest that I use my primary care, since it has been over 10 years since I've had it? I think they said I had 19 episodes in the course of the entire study, which was like from 8 p.m. to 5 in the morning or 9 a.m. to 5 in the morning. But again, that was about 10 years ago. Do you suggest I go through my primary care, or should I go through an ear, nose, and throat specialist first for my second? Go ahead.
Well, I will advise. Usually, it's best to go to your primary care physician. If I'm assuming that you have very good rapport and relationship to your primary care physician, they need to be the first to know how well you are doing or how not well you are doing with your Cpap. And then if they, once they've the dialogue with you, they can then request that you have another sleep test done. And now you don't have to go to the lab to do all of that. You can just have the device I was talking about. I have a sample here to demonstrate to everybody. You can just put it on, actually using that to be a segue to demonstrate that. I have an example of, a sleep ring right here. And this is simple, is a ring. You see that? It's almost like what you call the pulse oximeter. So when I put it on, it lights up. Can you see the light? Can everybody see the light? Yeah. So, and as I put it on now, before I fall asleep, it's acting like a pulse oximeter. The pulse oximeter just reads your heart rate and reads the oxygen concentration of the blood. And whether you are awake or asleep, it will be reading that oxygen concentration. And that is the measure that we are trying to maintain for a good night's sleep. We want to maintain the same amount of oxygen that I'm having when I'm awake going to my brain during the night. We don't want it to fall down below a certain threshold, which is what happens during the sleep apnea. And so this ring, all that you need to do is just wear this ring when you're going to sleep, after pairing it with your smartphone. So if you have your smartphone, you pair it with it, and you have this sleep ring is on you when you go to sleep. It will do all of the recording through the night. Even if you wake up at night to go and use the bathroom, you can take it off, wash your hand, dry your hand, and make sure the ring doesn't drop in the toilet or drop in the water. It shouldn't be immersed in any liquid. So make sure you keep it and then put it back when you are going back to sleep. The recording will continue where it stopped when you woke up to go and use the bathroom. And it will not break it because you woke up to use the bathroom. You may go to use the bathroom several times. For somebody who has nocturia, it will still record all of those events for you. So this is making sleep tests very useful and very user-friendly. So you can see it's not hurting, it's not doing anything, it's non-invasive. There is no wire connecting to your head, to your chest, to your nose, to every part of your body, which is what you get when you go for the sleep lab. Now, if after doing this, the sleep specialist still says that, oh, there still needs some things that needs to be studied about you because your case is so severe that this whatever report is gotten from this is not sufficient, then you will be sent to a sleep lab. And usually that will cost, of course, if you have insurance, you may not necessarily worry, but, it's often costs about $2,500 per night, $2,500 per night, but this will cost $250 per night. I mean, it's just like 1/10 of what you get. And the convenience that you have it in your home is non-comparable to going to the lab. Anyway, that is not because I want to make a sale, but it's just to let you see how easy using such a device is. And anybody could use it. It's available for both male and for children and adults.
A quick one, Dr. Ajagbe. How much is the sleep ring?
The sleep ring, if you buy it outright, is $300.
Okay.
But then you will have to pay for the report each time that you have to use it. But if you rented it, you pay $250. That includes the rental as well as the report. So it's one-time fee. And then every time you need to do a sleep study, it's going to cost you $250.
Thank you so much. You are on Medical Mondays with Dr. O, and this evening we are treating obstructive sleep apnea. That's reversing obstructive sleep apnea. Do remember to watch previous episodes of Medical Mondays with Dr. O on our YouTube channel, and please don't forget to like and hit the notification bell for all the notices. Also share the link with family and friends so that they will also be blessed like we are being blessed and educated this evening. On to the next question. Does sleep apnea cause weight loss or weight gain?
Sleep apnea actually will cause the individual to have a lifestyle change, which usually will include eating much more than they normally should. Because if you increase your ingestion of food, and most of the time it will be food that, actually will increase the body weight, then you're not, if you don't treat your sleep apnea, it's automatic that you will continue to gain weight. But if you treat your sleep apnea, your brain, you feel refreshed in the morning. You are not craving those things that your body will crave because you didn't sleep well at night. In fact, there are studies that have associated cravings of food like McDonald's, menus, because people don't sleep well at night. Because when they don't sleep well at night and they are not refreshed in the morning, they get all this advertisement about how going to McDonald's to wake up, is imperative for them. I heard this advertisement on Pandora. The lady was saying that until she goes to the McDonald's to get the McDonald's breakfast, she forgets the key that she's holding in her hand, and she puts her phone in the refrigerator until she gets McDonald's breakfast. So you can see somebody who is not sleeping well at night, the first thing they're thinking about is feel good type of craving in the morning, and they go to do that. So the ideal thing is to have the sleep apnea addressed, and the life of the individual will begin to become balanced, and they will see the need to actually lose weight. They may not even have as much craving as they were before the sleep apnea is addressed.
Follow up. Does caffeine intake affect sleep apnea negatively or positively? Caffeine.
Well, it's a vicious cycle, actually. If you look at it critically, if you don't sleep well at night, technically, if you're falling asleep during the day, you will always, you will always crave some stimulants. If it's not coffee, it may be Red Bull. It may be anything that will keep you awake. Some people will chew gum all day long because they want to stay awake. So caffeine is being addicted to coffee or caffeine is a sign that they are not getting enough sleep at night.
Thank you so much. And Belinda Waits into the insurance conversation, that a good insurance workaround is to refer patients to otolaryngology, and they usually will be successful with getting patients over to sleep study, because insurance companies are aware that it's part of the scope.
Well, yeah, absolutely. Okay, Dr. O, you can go ahead.
Thank you so much for that comment. Sometimes specialists can get things done with insurance companies when it has to do with that area of the patient's body. Primary care doctors have to have definite things that the insurance needs for a particular diagnosis for them to get it done. And when it gets to otolaryngologists, they have the tools, the equipment to look down in the throat, to look where they need to look, and then to convince the insurance companies that they saw this, they saw that, and so they should get, for instance, sleep study as we're talking about. So it's still the job of the primary care doctor to refer to otolaryngologists if that needs to be done. If there is, again, the primary care doctor has to have reason to even refer to otolaryngologists. So the Lord will continue to give us wisdom. But Dr. Ajagbe, I wanted to ask you, is your device covered by insurance?
Well, like any other device, as long as there is a diagnosis, if the appropriate diagnosis is made of obstructive sleep apnea, and there is justification or what they call the medical necessity for the treatment, there is no insurance that will shy away from paying for that, regardless of the amount. More so because oral appliance therapy is part of CMS's benefits to their subscribers. So, mandibular advancement therapy, biomimetic therapy, all of those are in the same category. The mechanism of action is different, but if it is, once there is a justification of medical necessity from the primary care provider, the insurance will not deny such a referral. Since the primary care physicians do not do such device, referral will justify that for the payment. And then the standard CMS form will suffice for that. The claim forms that is approved by CDC as well as CMS, will be, sufficient to either request a reimbursement or if the patient has already paid for it, they can get reimbursed. Or if they don't know, they want the insurance to pay for it directly, then the form has to be submitted to the insurance for prior authorization. But generally, what the insurance is looking for is medical necessity, and that is the justification coming from the primary care physician. And actually, you already know it. It has to do with the CPT code that you have that would determine whether that is going to be covered or not. If you don't have the right diagnosis, whatever you request with your, is not going to be covered. I mean, if you have the right diagnosis, but the wrong code. If you depend on the insurance, they're not going to pay for it. So usually the CPT code is what will be used even for the appliance, not the dental code. The dental diagnostic code is not going to be used in that case. It's a CPT code.
CPT or ICD-10 code?
Oh, ICD-10 is for diagnosis, but CPT is for the treatment. Yes.
It's for billing. Yes. So,
Yeah.
Mrs. Tower has a hand raised. Kindly unmute, please, ma'am. Unmute and ask your question, ma'am.
Good evening, Dr. Ajagbe and everybody.
Good evening.
Yeah, you did address one of my questions, but the other part of it about sleeping pill, you did not address it.
Oh, okay. Yeah, I was going to leave that as a second part to the to answering your question. Yeah, well, I think Dr. O might be able to address that as well. Sleeping pill, you have to know the mechanism of action of the sleeping pill that you use. That is being prescribed. However, if anything that causes somebody to fall asleep means the body, the muscles are going to become relaxed. So the sleep medicine is not going to make the tongue to be awake so as to prevent it from falling to the back of the throat because it's being administered. So anything that causes sleep will aid sleep apnea if the sleep apnea already exists. But if somebody doesn't have sleep apnea, taking sleep medicine is not going to give them sleep apnea.
Thank you.
Thank you, Dr. Ajagbe.
Be careful of sleeping pills, especially, I would suggest that one stays away from a class of sleeping pills called the benzodiazepines. That one stays away from those. Melatonin is made in the body. It's sold over the counter. It's a natural product, but as people get older, the melatonin in the system that causes us to sleep or fall asleep, decreases. So that can be replenished over the counter, and it helps a lot of people. But it will not change anything you take for sleep, like Dr. Ajagbe said. I just want to mention that it will not change the structural problems that may exist to cause the problem. It won't do that. So it's still important to get evaluated, and if there are structural issues to fix them. Otherwise, absolutely, the sleep aids or sleep medications will just be palliative, to say the best. It may not even help, sometimes because of those underlying problems. So evaluation is still key.
It may actually be a passport to fatality, because see, if somebody needs to be aroused because they can't breathe, but their sleep center is so shut down that they cannot even be aroused when they need to breathe, then we got problems. Somebody who is supposed to stop breathing for 10 seconds and be aroused to wake up, and it cannot do it, and then automatically may fall asleep permanently and not wake up. And that's something it may not be a lot, but the potential is there, particularly I would say for those who are overweight, because if there are structural issues and they cannot be aroused to wake up when they need to get enough oxygen in, there may be a problem. And they may term it as a negligence on the part of the prescriber of the sleep medicine.
Thank you so much. Lola says, if one buys the ring, how much will the report cost every time it is used?
The report is $150 each time.
Okay, thank you.
The rental itself of the ring is $100. The report is $150.
Thank you.
I use the ring. Dr. Ajagbe used me as guinea pig, and I wrote my impressions of the ring. When I used it for 2 nights, because the first night, of course, I slept for 4 hours or so, and it chastised me. So it was very simple to use. Like he demonstrated, you just put it on your finger and it does the reading. Great device. And I did it right in my own bed, not in a sleep lab. Those are all pluses. But I don't know if this is, then going forward, Dr. Ajagbe, say somebody have sleep apnea after that testing. So do they now go, come to you, or what's the next step?
The next step is simple. The first thing to do after that will be to refer them to me, because I have the access to the device that will reverse their sleep apnea if they do have structural issue. Now, if they don't have structural issue and they have severe sleep apnea, the best thing to do will be to go first to Cpap and begin to use Cpap. If they have structural problem and they have severe, diagnosis of severe sleep apnea, they should still start with Cpap while we investigate them for the device, because you don't want to delay their brain getting oxygen, over a long period of time because you're waiting to do evaluation. So usually when a patient is already diagnosed and they're already using Cpap, I encourage them to keep on using their Cpap because they still need to try to be healthy. I mean, oxygen to their brain is imperative. So I don't discourage anybody from using their Cpap if they already are using one. I actually try to encourage them and show them how better to use their Cpap if they don't know how to do it. If they once they are referred to me, then I will evaluate them. I will do, the first thing I'm going to request will be for them to have a CT scan of their head and the airway. Then that CT scan is CBCT, is usually done by the dental, imaging company or the dental office that has the equipment. The CBCT will not only give slices of the airway and the jaws and the tongue and everything. You can see it in cross section, you can see it in longitudinal section, and you can also see it in coronal section. That way you can actually see where the problem it actually exists. For instance, somebody who has partial or complete nasal blockage on one side and can only breathe through one nostril, will automatically be a mouth breather. You understand? Because so that if the person has been seen an ENT, the ENT cannot treat that patient without having somebody like me on board. They may do local excision and all of that, but the first thing will be evaluation. So once I have the CT scan and everything lines up that they do have structural problem, they have deviation of their the midline in their nose, in their nose. They have nasal blockage. Their jaws are not fully formed. They have, major indication for the biomimetic oral appliance treatment, and that is where we start. And once they have the CT scan, and we already established that they do have structural thing, then we will have to do the impression It could be manual impression using the usual putty that we use in the dental office, or we can use a digital scan, which is a 3D scanning of the mouth and the jaw and the teeth and the throat. And that will reconstruct in 3 dimensions the individual's anatomical features on the computer, and that is how the devices will be fabricated. And once the device is done, then the device will be delivered. The patient will be instructed on how to do it. They will wear this device for 18 months. That will be, for most part, most people will have their treatment terminated at 18 months. And once the jaw is grown, it cannot grow back. If it's grown, it's grown. If whatever amount of volume of bone or space created will not regress. There is not going to be a relapse that you find if you straighten your teeth with braces and you remove the braces and the teeth will bounce back to where they used to be. You don't see that with a biomimetic device because it actually grows bone. It grows it in 3 dimensions. So, so there is no fear that you're going to lose the space that you already gained during the treatment.
Thank you. There's a question in the chat. How much sleep are you supposed to get with the ring?
Excuse me?
How much sleep are you supposed to get with the ring?
The ring is not telling you how much sleep you should get. It's just monitoring how much sleep you got. And the work of the ring is not to tell you what to do. The work of the ring is to monitor what is happening regularly. So how do you sleep? How do you normally sleep? If you sleep for 4 hours, then that's how it's going to record it. It's not going to, this is not a device that can be rigged. You cannot pretend like you slept for 10 hours when you only slept for 2 hours. So it will monitor what you are doing, not tell you what to do. But if you have 4 hours instead of 7 to 9 hours, that is said to be normal, it will record that and tell you if it's supposed to give you a pass for 7 hours, and you did 4 hours, it's going to fail you, not by saying that you are going to die. It's just going to say that you are below the threshold. It will then give you what the threshold of normal is. If it's 7 hours, it will tell you you are below 7 hours, which is supposed to be normal. So it's not going to castigate you, but it will give you a color. The color will show, if it is red, it shows that you're far away from where you need to be. If it is amber or orange color, it means you are close to where you're supposed to be. But if it is green, then you are happy. You say, well, all is well, so I don't need to do nothing, and that's where everybody needs to be. The point of this device is just to help you be your best, whether you are awake or you are asleep. Because if you are not your best when you are sleeping, you will never be at your best when you are awake. You heard Dr. O talking about the person who is from DOT. You can pretend, you can say, I'm surviving on coffee or I'm surviving on Red Bull, but you are compensating in the wrong way. And that will account for why the individual will be gaining weight instead of losing weight or being normal, because their lifestyle is being, modified in the wrong direction because they're not sleeping well.
Belinda Bryant has a comment that most patients aren't aware that if you call your insurance company to inquire for yourself what the ICD-10 codes are needed to qualify for payment of diagnosis, the insurance company will inform you, which arms the patient with the symptoms needed to qualify for treatment. The Word of God says, to be it tells us to be as wise as serpents and as harmless as a dove. Gather your knowledge via your patient rights with these insurance companies and co-partner with your health care. That's a valuable piece of information.
And I agree 100%. And that is why I was saying that once you know what you want, it's easy for you to know where to go. Or sometimes if you don't know where to go, you can always ask. And I think almost anything now can be found on Google. I mean, I don't have any financial interest in Google, but I think there's hardly anything you can search for now in 2021 that you won't find on Google. Even if it's a small village in Africa that you never thought existed, you will be surprised. Google will bring it out to you. So information about insurance is imperative. The insured is the one that needs to be fully informed. Unfortunately, the medical providers have assumed the role that they should not over the years, all because we just want to get patients to come through our doors. However, we make ourselves to become employees of the insurance company by being the ones to search for, ICD code. We have to search for this, search for that. That's not supposed to be our job. I mean, it's supposed to be providing care, not to be the one that to be doing the work of the insurance company for them. However, because we want to serve our patients, we assume that role. But I think I agree with the comment. The insured, the patient themselves, have to equip themselves. In fact, the patient calls the insurance company and threatens that they're going to, disenroll. Most of the insurance companies don't like to hear that because they know money comes to them on a regular basis. And if you begin to have a chain of withdrawal from the coverage, from the premium, they are going to lose in their bottom line. So they know that. So the patient must empower themselves to go to the insurance company, find out what are my benefits, what is covered under my insurance policy. Well, they may give you a lot of fine prints, but you have to develop the interest in reading the fine prints too.
Thank you so much. Dr. Ajagbe, you mentioned weight loss. Apart from that, what are other kind of lifestyle changes that is needed for someone to improve sleep apnea?
Well, apart from the structural issues that need to be addressed permanently, any other thing that is a fallout from the sleep apnea needs to be addressed. For instance, somebody who drinks a lot of coffee during the day because they're trying to stay awake. Well, they have to begin, once they manage their their sleep apnea, there will be no need for coffee addiction anymore. Apart from those who say, well, I'm cutting on drinking coffee, but I'm addicted to the aroma. Well, you can still enjoy the aroma, but not drinking the coffee because the stimulant will give you a vicious cycle. Because for some people, they do not break down their caffeine over time, and more so when they drink it till late in the evening. Sleeping with coffee in their system that's supposed to keep them awake, and sleep apnea, they're not good company. They will synergize in the wrong direction, because the patient will not sleep well because their brain is still wired up, and they can't sleep well because the airway, the little time they fall asleep, the airway is blocked and they are aroused to wake up. So it's a vicious cycle that has to be broken. That's one of the lifestyle changes that have to be in place. And those who, are addicted to all those fattening foods, they also have to address that, because, you know, if the sleep apnea is being addressed and they do not address that, they will also be creating a vicious cycle. They will be gaining weight rather than losing weight. There are many, I would say the primary care physician can help, dietitians can help, and lifestyle medicine practitioners can help. And these are ways by which people can move in the direction of plant-based, you know, nutritional values that is coming from eating more vegetation rather than eating animal products. So.
Excellent information coming our way. Thank you so much, Dr. Ajagbe. Remember, strong health, strong future. That's our mantra. And that brings us to our Medical Monday moment.
Fantastic. Thank you so much, Dr. Ajagbe, for that wealth of information. Very much needed information, especially in the time of COVID. Sleep is very important in this time of COVID. If you see, you know, what our pulmonologists are putting out, zinc, vitamin D, vitamin C, to boost your immune system, you will see that melatonin is added. Sleep is very important. So thank you so very much. We appreciate you. Medical Mondays moment. I just want to say what the Lord has done for us in Ghana. We saw 1,500 people in 2 days. You know, we still have missions coming up. We're gearing up for our next round. And we were surprised at so many people with blood pressures, 240 something over 130 something. And in fact, one of the doctors was asking at one time if she should send a patient to the hospital. We had ambulance there on site, but with each one of them, we were able to reduce the blood pressure and so then, you know, link them to care and intervene appropriately. We diagnosed so many breast cancers, eye issues. The ophthalmologists, the doctors here in Ghana are just phenomenal. And we just praise God for what the Lord has done and for what he will continue to do. We are excited, even though we are a little bit, you know, tired, the long hours, but the Lord has just been phenomenal. Also, so many people give their lives to the Lord and have been plugged in for discipleship. So that's my Medical Mondays moment. And I didn't have anyone email to say that they got 10 or more people on the forum. So we're not going to give out any gifts this week. I want to, though, especially thank Dr. and Dr. Ephraim and Hannah Ajay. They made it so that our medical missions have worked seamlessly by contacting the folks here to provide doctors, nurses, counselors. We even have someone taking pictures, you know, the camera person, all from them. First day we had at least 20 people that volunteered to work with us. And every single one of them has been phenomenal. So I just want to praise God for Dr. and Dr. Ephraim and Hannah. Please unmute and just let's appreciate you. If everybody would just please help appreciate them. I'll appreciate that. Thank you.
Thank you. Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you, doctor.
Thank you.
Thank
You are
you. Thank you,
appreciated.
Dr. O. We miss you.
Great job. Great job.
Thank you.
Great job.
We'll be back soon. We hear that.
All right. Johnny Mercies.
Thank you. Thank you. We heard that Omicron is ravaging Nigeria. I got a call today that some flights are not even flying into Nigeria anymore from today. So next week, we'll revert back to COVID so that we can see what is going on with Omicron. Does everybody agree that we need to, see what's going on around us with this new variant? Comments?
Yes, indeed. We need to find out the extent of variation.
Thank
And yes, yes.
So next week, we'll be dialoguing about that. I don't know what the end of this virus will be, but by God's grace, we'll get to the end of it. This new variant seems very interesting. I thought HIV was evasive. COVID-19 has beat all the viruses that we know in medicine so far. It's just an interesting virus. So over to you, Honorable.
Thank you so much. Before we go.
So much. Thank you for that. We are trying, we wear a mask all the time. We've given away hundreds of masks. We're educating people to put on their mask. I had little children. One girl told me, I don't have a problem, so I don't need the mask. So I spent the time to, educate her on why we need to put on a mask for now. Do you know that the next thing I knew, she started bringing all her friends. They teamed up, I want mask, and I taught them how to use it. So we're doing our best to, still stay, to keep the 6 feet distancing, wearing a mask, and we are all immunized, all of us on our team. And thank you so much, though, for encouraging us to keep safe. Thank you.
Indeed, indeed. All praises be.
Amen.
Yes.
Thank you so much. Before we leave, Dr. Ajagbe, your closing remarks.
Well, thank you all for your attention. I know sleep disorder and sleep disordered breathing is not something that many people want to listen to or even consider as being an issue. If you say, oh yeah, you snore like a freight train, they say, yeah, that's how my father used to snore. My grandfather used to do the same thing. So I don't think it's anything to worry about. Time of ignorance is past. Now there are ways of finding out that the snoring is not an innocent snoring, that actually the quality of life and the length of life can be shortened because of sleep apnea. And there's a lot of literature to support that. The quality of life cannot be improved if the sleep if the quality of sleep is going down the tube. So we have to do everything if we suspect that we do have a problem, that we should seek help. I know most people, instead of thinking of the quality of their living, they think, oh, I don't have money. If not having money is the first thing you're thinking about, then you are actually acquiescing to the potential of, shortening the life that may actually become more prosperous in the future than what it is right now. So I will advise that you should take the excessive daytime sleepiness questionnaire test for yourself. It's not diagnostic, but it's an indication. If you need such information, I can make it available to you. But if you do this excessive daytime sleepiness evaluation and you find out that you are having problem in that area, it is then time for you to talk to your doctor that you will need a sleep test done. And once you have the sleep test done, investing a little bit of money in the quality of your living for the rest of your life, it should not be a deterrent for anybody. So you should inquire about the sleep test that is available. I've demonstrated one to you. You are free to choose any sleep test you want. However, it's if you don't comply with the instructions, then it's not going to be a benefit to you. So I will, stop right here and say, if anybody needs any additional information, I posted 2 links to 2 websites. You can copy that and search for those links, and more information will be found on the websites.
Thank you so much, Dr. Ajagbe, for sharing that important information and facts with us. And thank you all participants for choosing to make health and wellness your priority. This evening, we have been discussing reversing obstructive apnea with Dr. Oluwole Ajagbe, the doctor of dental surgery. We will be coming your way same time next week with another edition. Medical Mondays with Dr. O. Good night and thanks for coming. Have a lovely